Many women view their monthly period as an inconvenient visitor, a messy interruption to their daily lives. However, your menstrual cycle is so much more than just a nuisance. It's a vital sign, a barometer of your overall health and well-being. Just like your temperature, blood pressure, and heart rate provide crucial information about your physical state, so too does your menstrual cycle. Think of it this way. Your body is in constant communication with you, sending signals about what's going on inside. Your period is one of the most powerful messages it sends. By paying attention to your cycle, you can gain valuable insights into your hormonal balance, reproductive health, and potential underlying conditions. Learning to understand your menstrual cycle isn't about becoming obsessed with every twinge and cramp. It's about empowering yourself with knowledge. This knowledge allows you to make informed decisions about your body and take proactive steps towards optimal health. Remember, your period isn't the enemy. It's a powerful ally in your journey to understanding and nurturing your body. Before we delve into the nuances of what's normal and what's not, let's establish a baseline understanding of the menstrual cycle itself. A typical menstrual cycle lasts between 21 and 35 days, though variations from woman to woman are entirely normal. The first day of your period, marked by the arrival of menstrual flow, is considered day 1 of your cycle. Bleeding usually lasts between 3 to 7 days, with the heaviest flow occurring in the first few days. It's important to note that cycle length and the duration of bleeding can fluctuate from month to month, even in healthy individuals. Factors such as stress, diet, exercise, and medication can all influence your cycle. However, consistent, drastic changes in your menstrual pattern warrant attention and could indicate an underlying health concern. Understanding your own unique cycle is crucial. By tracking your periods over several months, you can establish your personal baseline and identify any significant deviations. Remember, knowledge is power. The more you know about your own cycle, the better equipped you are to advocate for your health and well-being. The color and consistency of your menstrual blood can offer valuable insights into your hormonal health. While a bright cranberry red flow is generally considered normal, variations in color and texture are common and can be influenced by factors like flow intensity, age, and the presence of uterine lining. For instance, dark brown or almost black blood at the beginning or end of your period is often simply older blood that has taken longer to exit the uterus. On the other hand, a consistently pale pink or watery flow, especially if accompanied by irregular cycles, could indicate low estrogen levels, which are common in athletes or those with eating disorders. The consistency of your flow can also provide clues about your health. A thick, jam-like consistency with clots can be normal, particularly on heavier flow days. However, an abundance of large clots, especially if accompanied by severe pain, might suggest a hormonal imbalance or uterine fibroids. It's important to remember that every woman's body is different. What is normal for one woman may not be for another. However, any sudden or persistent changes in your menstrual blood's color or consistency warrant a conversation with your healthcare provider. While some degree of variation in menstrual cycle length is normal, significant and persistent irregularities can signal underlying health issues. Irregular periods are broadly categorized as cycles shorter than 21 days, longer than 35 days, or cycles that vary significantly in length from month to month. One common irregularity is oligomenorrhea, characterized by infrequent periods, often with cycles exceeding 35 days. This can be caused by a range of factors including hormonal imbalances such as polycystic ovary syndrome, PCOS, thyroid disorders, excessive exercise, or stress. On the other hand, frequent periods with cycles shorter than 21 days are known as polymenorrhea. This can be caused by hormonal fluctuations, uterine polyps, or fibroids. It's crucial to consult your doctor if you experience persistent polymenorrhea to rule out any underlying medical conditions. Another common irregularity is spotting between periods. While occasional light spotting might be harmless, especially if you've recently started a new hormonal contraceptive, persistent or heavy spotting between periods can indicate hormonal imbalances, fibroids, polyps, or even infections. Irregular periods shouldn't be ignored. They are your body's way of signaling that something might be amiss. By paying attention to your cycle and seeking professional guidance when needed, you take charge of your reproductive health. Section 5, Painful Periods and PMS, What Your Body is Trying to Tell You. While mild discomfort during menstruation is common, debilitating pain and severe premenstrual symptoms, or PMS, should not be considered normal. Painful periods, medically known as dysmenorrhea, can significantly impact a woman's quality of life and may signal underlying health conditions. One of the most common causes of dysmenorrhea is the overproduction of prostaglandins, hormone-like substances that trigger uterine contractions to shed the lining. However, conditions like endometriosis, where uterine-like tissue grows outside the uterus, can also cause severe menstrual cramps and pain that radiates to the back and legs. PMS encompasses a range of physical and emotional symptoms that occur in the week or two leading up to menstruation. These symptoms can include bloating, breast tenderness, mood swings, irritability, fatigue, and food cravings. While the exact cause of PMS is unknown, hormonal fluctuations, chemical changes in the brain, and lifestyle factors are believed to play a role. If you experience severe period pain or debilitating PMS that interferes with your daily life, it's essential to consult your doctor. They can help determine the underlying cause and recommend appropriate treatment options, including pain relievers, hormonal contraceptives, or in some cases, surgery. Section 6. Fertility clues and thyroid signals in your menstrual cycle. Your menstrual cycle is a powerful indicator of your fertility. Understanding your cycle helps identify your fertile window. The fertile window starts 5 days before ovulation. Ovulation is when a mature egg is released. Every woman's cycle is unique. Track basal body temperature and cervical mucus to pinpoint fertility. Your thyroid regulates hormones affecting your cycle. Hyperthyroidism can cause irregular periods. Hypothyroidism can lead to heavier periods. Consult your doctor if you notice persistent irregularities. Section 7. Nutrient deficiencies and stress. The silent disruptors of your cycle. Nutrient deficiencies and chronic stress can disrupt your cycle, causing irregular periods and exacerbated PMS. Your body needs the right fuel and a calm environment to function optimally. Iron deficiency can cause heavier periods, fatigue, and pale skin. Iron is essential for red blood cell production. Replenish iron through foods or supplements. Deficiencies in vitamins. B6, B12, D, and magnesium also impact your cycle. These nutrients influence hormone production and menstrual health. Chronic stress can wreak havoc on your hormonal balance. Stress increases cortisol, interfering with estrogen and progesterone. Elevated cortisol levels disrupt your cycle. A balanced diet and stress management techniques can improve hormonal health and menstrual regularity. Section 8. Taking charge. The power of period tracking. In today's digital age, taking charge of your menstrual health has never been easier. Period tracking apps have revolutionized the way women understand and manage their cycles, providing valuable insights into their bodies and empowering them to make informed decisions about their health. These apps allow you to log your period dates, flow intensity, symptoms, and even mood changes, creating a comprehensive overview of your cycle over time. By analyzing the data you input, these apps can predict your next period, fertile window, and alert you to any potential irregularities. Some popular period tracking apps include Clue, which uses science-backed algorithms to track your cycle, predict your period, and identify patterns in your symptoms. Flow, a highly personalized app that provides insights into your cycle, fertility, and overall health. Glow, a comprehensive app that allows you to track your period, ovulation, mood, sleep, and more, and natural cycles. An app that is FDA cleared as a form of natural contraception, using your basal body temperature data to identify your fertile window. Remember, while period tracking apps are valuable tools, they shouldn't replace professional medical advice. If you experience persistent irregularities or concerning symptoms, consult your healthcare provider. Section 9. Listen to your body, when to seek professional help. While most menstrual irregularities can be attributed to lifestyle factors, stress, or minor hormonal fluctuations, certain red flags warrant immediate medical attention. Your body is constantly communicating with you, and it's crucial to listen to its signals. Seek medical attention immediately if you experience any of the following: extremely heavy bleeding, such as soaking through a pad or tampon every hour for several consecutive hours, severe pelvic pain that disrupts your daily life and doesn't improve with over-the-counter pain relievers, consistent or heavy spotting between periods, any bleeding after menopause, missing 3 or more periods in a row, especially if you're not pregnant or breastfeeding, and sudden, unexplained changes in your cycle, which could be a sign of an underlying medical condition. Remember, you are your own best advocate. Don't hesitate to reach out to your healthcare provider if you have any concerns about your menstrual health. By listening to your body and seeking professional guidance when needed, you take proactive steps towards a healthier, happier you.